Well, this month marks the 5-year anniversary of the COVID-19 pandemic in New Jersey, when a 32-year-old man from Fort Lee was diagnosed with the virus, and little was known about how the disease spread or how much of a risk it posed. The first death would come just 10 days later. For many now, though, the pandemic may feel like a distant memory, with flu and other respiratory viruses taking center stage. But the virus, which continues to mutate, isn't gone, and its effect on New Jersey and the world are still very clearly being felt. For a look back at where we started and where we're at now, I'm joined by healthcare writer Lilo Stainton. Lilo, what a great piece. It's hard in some respects to believe that this was 5 years ago when that first case was reported. And I guess the question everybody wants to know is COVID still a threat, or how much of a threat is it 5 years later?
Yeah, I mean, it is still a threat, and it's significantly lower than it was 5 years ago. However, one thing we did not mention in this piece, and there will be more to come, is, for some people, it's never gone away, right? There's long COVID. There are people whose lives have been forever changed by it, whether they lost someone or, someone in their life was forever changed in another way, a job loss, whatever. So I think the impact is still really big for some people. There was a Pew poll done that showed, like, for 3/4 of the people it had an impact, but they're also largely over it and have moved on. And when you look at the data as far as infections, and we got sort of trained in the public of looking at this data, the flu is a much bigger threat. I think it's almost 8 times as many people going to the emergency room in the end of February from the flu than there were from COVID. So we're in very, very different times.
When you look back at that data, which you went through really thoroughly in your piece, what was the turning point?
I think there were several, and really, I mean, credit really goes here partly to Colleen O'Day, who, not just did these graphics for this story, but her graphics, I know readers and viewers depended on some of this stuff from us. And I also just want to say, as a reporter, I depended on it because her graphics laid it out in a way that really enabled you to get that story. I would say there were several turning points. I mean, when we started to do the crackdowns in New Jersey, I mean, these were really controversial executive orders. Remember, hair salons, nobody got their hair cut out anymore. Restaurants, bars, it goes on. Events,
gyms,
we closed
everything,
parks,
yeah.
and we reopened parks. That was a turning point. Vaccines was another turning point. And then Omicron was a third turning point, I would say, because that one just showed us, the scope of an ever-changing virus is really hard to imagine. The damage can be severe.
So where does that leave us now?
Right. So I think we are in a much more, we're in a better place with the data. One of the other stories I'm working on looks at sort of, are we better prepared and what did we learn? Well, we learned a lot of things sort of clinically and sort of systems-wise, health systems-wise. New Jersey as a state did a fair amount of work to figure out its own sort of governmental response, what was good, what was not good. And some of those plans are very, very useful, will be very useful in the future. However, everybody tells me there are still gaps in what we know, what we, public funding or funding for public health is extremely limited. It is going in the wrong direction, you could argue, if you're doing that work and depend on that work, which we all do. But also, we have a very unstable situation at the federal level right now. And what that means in terms of disease control is the numbers aren't necessarily updated regularly enough. Sometimes they're 2 or 3 weeks late, sometimes they're much more. Funding is a big question. Policy decisions, will you have support if you're a governor and you decide you have to close schools again? God forbid, nobody wants that, but maybe it is your least worst option, right? Yeah. No, those are the things that are hard to tell given what's going on the federal level, what would happen if we had another pandemic. And I would just note, H5N1 is not an immediate risk to the human public. We have people in the state who have already lost cats. We have people who have lost birds. It is a virus, it evolves. We should keep
Keep an
that
eye.
at the front of our minds.
Yeah. Well, of course, you can read all of this and more on our website, njspotlightnews.org. Lilo's reporting is there, along with all of those graphics that break it down through the years. Lilo, thanks so much for coming on.
Thanks, Bree.